Connecticut, Commissioner Beth Bai and Ms. Allison Logan, and all those who are here today to speak about the American Rescue Plan Act. I also want to acknowledge a special person here, Dr. Tom Coley, who is our regional president of the Shoreline West region, and also you are invited guests. We are very honored that you have chosen Housatonic Community College to impart this important announcement, which I know will be welcome information for many of our students who are balancing responsibilities of new parenthood with the need for education and training that will allow them to improve the quality of life. We know that education transforms lives and changes the trajectory of one's life. So we are excited that this Thursday, we have the honor of graduating over 575. Yes. Now get this. This is a 26% increase from pre-COVID. 26%. And so on that day, the chains of poverty will be broken. And you will see that the lives of our scholars are transformed. So thank you, Governor Lamont, for your support of higher education and support of Housatonic Community College. On behalf of the entire community that makes up this great campus, I thank you, the Office of Early Childhood, and the community organization that will provide the much needed support to support our families in this state. Thank you so very much, and have a great, great program.
Thank you so much, Dr. Smith. I think it's really great that we're here at a community college celebrating a program called Cradle to Career, because that's what Governor Lamont is looking to do with the American Rescue Plan, is how can we help accelerate Connecticut from cradle to career. I'm really excited to be in Bridgeport, and it's no accident that the governor came to Bridgeport today to lead this conversation around universal home visiting and community health workers. The work being done on Baby Bundle here is a model for the state of Connecticut and was part of the inspiration for the state proposing a universal home visiting model. Governor Lamont, with this approach, is taking a smart approach to investing the American Rescue Plan funds. The strategy is grounded in research about the positive impact that early investments have on child and family outcomes, impacts that have a long-lasting effect. Universal home visiting, coupled with community health workers, is a community-based strategy to reduce both health and educational disparities, which we've seen laid bare during COVID. I had the opportunity to talk to Millie here this morning, Millie Segano, who is a president of the Community Health Workers Association of Connecticut. And in fact, she's a founder. And what she said to me about today that really hit me was she said, this approach is about people's quality of life. How can we improve people's quality of life? And Connecticut is really known as a state that has a high quality of life. We know we can make it better for more of the residents. As I was preparing for today, there were two articles in newspapers this weekend, one in the Hartford Courant, the other in the New York Times, that very much brought home today's focus. In the New York Times, Nicholas Kristof wrote an op-ed called "If There Were Only a Viral Video of Our Jim Crow Education System." Kristof argues that we have to do a better job challenging the inequities that don't come and don't show on a viral video, especially in education. And it's true in public health, too. Commissioner Gifford has been such a great leader and spokesperson about addressing public health disparities before they start. Kristof's solution is that we don't have perfect solutions, but programs like universal home visiting reduce racial and economic gaps over time, and that the time to start investing is early childhood. Then this weekend, I'm sure so many in this room saw the very disturbing article in the Hartford Courant about the impact of coronavirus and inequities on children's mental health. And Chris is here from DCF that's going to talk to us a bit today as well. But the current trends, according to CDC, are that between April and October, the proportion of pediatric emergency department visits that were related to mental health rose by 24% for children 5 to 11, which is, we're looking to prevent those problems before they start by building family resilience with universal home visiting from the start. So today we're talking about a coordinated approach to supporting families from the earliest days in ways that have long-term impact on both children and families. They build resilience and prevent later mental health and educational challenges that we hear about in the press all the time. And we say, how are we going to address this? We're going to start early. And early interventions show that they save money long term. Universal home visiting, for example, saves up to $3 for every dollar invested. And community health workers have a similar number. There's a 50% reduction in emergency room care in communities that have universal home visiting. There's real savings there. There's a 28% reduction in clinical anxiety among families and a 44% reduction in child referrals to child welfare agencies like DCF. And again, Krista will address this. That's just universal home visiting. The governor's approach ties universal home visiting to community health workers who are trusted community members. Think about how much more savings there would be then. You're going to hear from others today, much more eloquent than I, about how early interventions have been important to them. A special thank you to Allison Logan and Janice Grundell and so many others in Bridgeport for their leadership. Also want to recognize Ashley McAuliffe is here from my office, who's been doing a ton of work on this proposal as our leader of home visiting. Gail Weinstein, who's here from Social Venture Partners, who's really been instrumental in helping us design this around the COGS, the government agencies. So it's really for the whole region. It's about being universal. And the Connecticut nurses are here to voice their support. It's now my real pleasure to introduce someone I think that the whole state has come to admire. But I admire her charge to us, the other commissioners, to let's get this American Rescue Plan right and let's invest early. Deidre, welcome.
Good morning, everyone. Good morning, Governor. Thank you, Commissioner Bai. And I am so proud to work alongside Beth Bai, who there is no stronger champion for children and families than Beth Bai. So thank you very much for your work. And I am also so proud to be working for a governor who understands that investing in early childhood is a smart investment. It's the right thing to do, and it's also the smart thing to do. So as Beth described, the Governor's American Rescue Plan Act proposal has two components around early childhood in particular. One that Beth referred to is to put us on a path to universal home visiting. Every single one of the 35,000 or so children born in Connecticut each year would receive a visit from a nurse or other qualified worker, 3 visits, right after birth. They would be offered those visits. These kinds of programs, although they seem like a small investment, have shown over and over and over again to have long-term impacts on both the family and the child. Then the governor's proposal does something else. He pairs it with a longer-term program for a smaller number of highest risk families to have a community health worker visit them in their home. So about the 10% highest risk families would be visited by a community health worker. What would they do? Community health workers, as Millie can testify, are a proven intervention to help families with things like navigating our very complicated healthcare system, support for breastfeeding, making referrals if there's intimate partner violence in the home, helping with nutrition and counseling, providing just general emotional support at a time that's very challenging for all of us, that is right after the birth of a newborn. And we know that these programs can prevent things like chronic disease. They can prevent emergency department use. They can prevent challenges in education. And so they are a very smart investment. For about $1 invested, we see $2 to $3 saved with this type of program. Why community health workers? Community health workers are as the name would imply, they're from the community where these families live. They are trusted members of the culture, and they sometimes speak the language, and that is why they can have a bigger impact than somebody like me or Beth, who may or may not be trusted by the family and who may or may not share the culture and language of the family. What we expect to see from this type of a program: lower costs in programs like Medicaid and all of our health insurance. We expect to see better educational outcomes for these children, lower incidence of dental problems, lower incidence of chronic disease. I was thinking as I drove here, if this program was a pill, every doctor would prescribe it because, because they are a low-cost investment for a big improvement in outcome in the long term. And now it's my pleasure to introduce Krista Ryder from our Department of Children and Families. She's the Behavioral Health Program Director here in Bridgeport, and she's going to tell us about some of the benefits these kinds of programs can have in child welfare programs. Krista?
Thank you, Governor Lamont, for this opportunity today to speak about the ongoing support for our Connecticut's children and families. On behalf of Commissioner Vanessa Durantes, we are appreciative of your steadfast support, as well as our partners like Commissioner Bai and Commissioner Gifford from the Offices of Early Childhood and the Department of the Acting Commissioner of the Department of Public Health. Thank you to our partners from the United Way and Optimus Healthcare, along with our state and local officials who are here today. Let's pause a minute and take a look around. Imagine what our young children in our communities would say today if they saw us. What would they think? Today shows a strength for Connecticut's children and their families. Leaders planning for today, tomorrow, and the future. Our message to Connecticut's children and families: we are here for you and we walk with you. The pandemic has affected all Connecticut families. The pandemic has taught us lessons in what happens when valuable resources are stretched. The pandemic has exacerbated stressors within families and their communities, resulting in prolonged toxic stress and generalized isolation of children. Poverty is an insidious ripple effect, often masquerade in the Child Protective Service reports we receive every single day. Like every other jurisdiction in this country, Connecticut is not alone. We know the vast majority of Children Protective Services reports are categorized as neglect, not abuse. In 2018 and 2019, about 84% of all accepted reports had at least one allegation of neglect. This proportion increased in 2020 to 87.9%. When assessed, it is determined that the neglect allegations oftentimes don't reflect child maltreatment, but actually implications of poverty. Targeting child poverty is the answer to this country's pandemic recovery. What do we know about our families? Parental substance use, unstable housing, untreated mental illness, as my colleagues have identified, all negatively impact parental capacity. The younger you are, the more vulnerable you are to all the adverse circumstances around you. This age is consistently at risk in every jurisdiction across the country. According to the most recent Connecticut data, children less than 1 year old make up a third of the total entries into our foster care system, with children 0 to 5 making up 55% of the total entries into foster care last calendar year. We cannot talk about child well-being without talking about outcomes for every single child in Connecticut. Equity is key here. Children of color are reported more often to Child Protective Services. Their parents are substantiated more often, and they're more likely to be removed from their family of origin and remain in care. So what do we do? In order to help our youngest in the most equitable fashion, the implementation of Universal Home Visiting Program and Family Navigators will go far to address the issue we just outlined. Pay attention to the two wordings found in this program, home and family. Let's bring support right into the family's home right after a birth of a child. Let's wrap that family with the needed supports at the beginning stages of their lives. Family navigators will be credible messengers within the local communities to connect families to localized supports right in their own neighborhoods. They will work and support to remove the negative stigma of asking for help. Our work at DCF is evolving, with a mission shifting from a system of solely child protection to collaborative well-being system that places priority on prevention and early intervention. We believe families need local support, they don't need government surveillance. Connecticut has reimagined its system to develop supports for families upstream, with the goal of families being diverted from the involvement of child welfare agency while receiving supports right in their own community. Support is all of our responsibility. Our message to families and children across Connecticut: we are here for you and we walk with you. I'm going to pass it to Ms. Logan. Thank you.
Good morning. First of all, thank you to Housatonic Community College, who's an amazing partner for Bridgeport Prospers and our work at the United Way, so thank you for hosting us here today. Thank you, Governor Lamont, Commissioner Bai, Commissioner Gifford, and Director Ryder, and all the community partners here in attendance today, especially to the Bridgeport Prospers United Way staff that helped coordinate this on a very quick basis today. And our amazing community messengers. There are several community messengers in the audience that really help us lift the voices of the community, and they are a part of everything that we do. So thank you to our community messengers that are here today. I am Allison Logan, Executive Director of Bridgeport Prospers, which is a cradle-to-career collective impact initiative of the United Way of Coastal Fairfield County. I would like to acknowledge my other Connecticut cradle-to-career partners, Waterbury Bridge to Success, Norwalk Axe, and Stamford Cradle-to-Career. The extreme inequalities of the COVID-19 pandemic and the outcry against systemic racism pushed racial equity to the forefront of public consciousness and policy debate. Our cradle-to-career communities have acknowledged how current and historic policies and systems have contributed to racial inequities and have pledged to focus on redesigning them toward racial, health, and educational justice. Our 4 communities use the collective impact framework that is supported by the nationally recognized Strive Together network. Together, we are using data and community leadership to drive decision-making, empowering and building capacity within our respective communities, and convening cross-sectors of the communities to promote equitable systems building that leads to aligned action. In Bridgeport, for the last 5 years, this community-driven aligned action has led to the creation of the Bridgeport Baby Bundle, with the outcome goal that all babies in Bridgeport will be healthy and reach developmental milestones by the age of 3. The framework is anchored in the neuroscience of trauma to resilience, along with a bundle of equitable whole family supports, which represents a sweeping systemic infrastructure change effort to equip young children and their families for what they need to thrive. Universal home visiting has been a core element of the Baby Bundle since its inception, providing universal access to all mothers, regardless of income or socioeconomic status, addresses health inequities from day one, and reduces the stigma often associated with home visiting. Having a baby is a big life change. Every family can benefit from the support and connections home visiting provides. Through prenatal engagement with community health workers and our amazing doulas in the city, then postnatal universal home visiting services with a registered nurse, a family would be screened for risk factors and assessed for needs. Referrals to services would be made if necessary, whether that includes more intensive home visiting or non-home visiting services, such as basic needs, mental health care, job training, or housing supports. This creates an ongoing supportive relationship that builds trust and wraparounds the mother, father, baby, and family. This American Rescue Plan investment would initially cover the greater Bridgeport, Hartford, New Haven, Waterbury, and New London areas with a commitment to an intentional community-based system which prioritizes community voices, co-developing alongside from design to rollout. Being a community-led cradle-to-career initiative as we are, this commitment to prioritizing lived experience and leadership from within the community is a game-changing opportunity to equitable redesign of the prenatal to 3 systems across our communities and eventually across the state of Connecticut. I would now like to turn it over to one of our amazing partners in this work, Dr. Paula Garay, who is the Women's Health Initiative Director at Optimus Healthcare.
Good morning, everybody. Good morning. Thank you so much for having me here today. I'm so excited. Good morning, Governor. It's a pleasure and an honor to be with you today. I'm so excited to be here. First, my name is Dr. Paula Garay, and I have the pleasure of leading the Emmy Coalition at Optimus Healthcare. Mr. Spinelli is my CEO. He's sitting right there. And we provide services to women and girls ages 12 to 49. And we use community health workers to a great extent. So I can speak to you from a personal and professional experience of what a community health worker can really do for a family. Not only do they build trust, but they also have tons of tools and resources that they can provide these families. And when you have a baby, you're confused. It's really the most exciting, most beautiful moment of your life, but at the same time, it's the most terrifying and confusing time. And if you're home alone, it can get isolating, even though you're not alone because you have that baby all the time. And even if you have your partner there with you, or if you have friends or family helping you, there's still that sense of isolation and loneliness. So universal home visiting, someone that can be there and ask the mom, how are you? Or ask the parent, ask the father, how are you? Because all everyone cares about when a woman has a baby is, how's the baby? How's the baby doing? How's the baby eating? But is the mom eating? Is the father eating? Are you sleeping? Do you need help? Do you need extra resources that we do have in the community? But a lot of times it's not just access to care. The care is there, but people don't know that it exists. People don't know that the resources are there. So this would be a way to let everyone know of the wonderful resources that exist in the community. Not only that, but a community health worker or a nurse, a visiting nurse, can see if there are other issues with older children. And that's something that we have discovered by using community health workers and them getting close to the families is, yeah, everything's going well with the baby. Well, what about the 3-year-old, the 5-year-old, the 10-year-old that is now being neglected or pushed aside because all the attention and everything goes to the baby? So even though we're focusing on the baby, in reality, we're focusing on the entire family, because if someone in the family is not doing well or is not healthy, then the entire family cannot be healthy. I can tell you from my patients, the patients that we work with, this would completely change their lives. Not only, now they work with community health workers through our program, but that's only 100 women. If this could be offered to the thousands and thousands and millions of women all over, it would be a completely different lives, not only for the moms, for the children, for the older children, for the entire families, because when someone in a family is suffering, everyone else suffers as well. I can tell you from a new mom perspective, I have a 1-year-old and a 3-year-old as well. I have wonderful insurance and access to care, but I also felt alone, and if I had someone come over my house and ask me, like I said earlier, how are you doing? What can I do for you? I think a lot of those negative feelings that one feels that sometimes you don't share with others, maybe I would have shared those with someone that's not in my family. Because there's always that, I don't want to tell my husband that I'm not doing well or that I'm tired, but maybe you will talk to somebody that has built trust with you, but that is not part of your family, because you're more likely to open up to them. This, again, would completely change everyone's lives. It would set the children and the families up for success. I see it on a daily basis, the wonderful work that all community health workers do. They're angels in our community, and I don't think they get enough recognition. But they really transform the lives that they touch. They're caring, they're members of the community, so they know not just the people, but they're from the same neighborhoods that our patients are from. So I 100% support this. I think it would be a beautiful thing for everyone to be able to take part in this. Again, thank you for your attention, and I would like to introduce Lamont Ware, who is a parent of Bridgeport and a public ally. Thank you.
How y'all doing? Good evening. My name is Lamont Ware. I am a community liaison with the United Way of Coastal Fairfield County, but also a public ally. Thank you for Ned Lamont for coming out. Shout out to Damaris, community messenger with me. And yeah, I'm here just to speak from the father's perspective, because a lot of time in this process, the father is overlooked and could be like overshadowed. And when I didn't understand it until when my son was born, and how much attention that the mother of my child got. And when she would get all the attention, I was wondering, okay, so when are they going to tell me certain stuff that I need to look out for, and what I should what I should be doing, especially being the support. It was just felt like I was just the plus one. so you know, and it would have been nice just to know some of them things, especially when my uncle told me you're supposed to come in this world and then leave it better when you left. So if I want to teach my son how to be a leader of men, I need him to teach him empathy and how to be able to identify things in his partner, especially if he makes a big decision like having a baby. Because there's nights where I would have to go to work, but she's a new mother, a young mother at that, and she's just getting used to breastfeeding. So what can I do to help in that situation, or especially like how do I identify postpartum depression if I've never seen it before? I've heard about it from my friends, but I've personally never seen it before, and I've learned it comes in different forms. So I felt like that information in with universal healthcare, that would be great, especially having people come into the homes, give fathers insight to let them know, like, all right, this is what you need to look for. This is what you could do. These are some of the things that you could do. If you feel like she looks tired, you could take the baby for a couple minutes, prepare the breakfast, do what you need to do to be a support, because it's a team effort. It's a team effort. So that's why I always felt like you shouldn't just make it seem like, all right, everything's on the mother, because you giving her like, oh, you gotta do this, you gotta do that, and you're putting a lot of pressure on her, because making it feel like she's by herself when she really isn't. So that's why I felt like it's important to come here, speak on behalf of the fathers, especially because I just seen my young son before I left, and I really wanted to take him here, and I would have gave you this big spiel about like, yeah, I came here dressed like this because I wanted to show you what real fathers in Bridgeport look like. But the whole real reason is that my son ran up to me to give me a hug, and he had pizza sauce on his hand. He messed up my shirt. But that's the beauty of having kids. And I'm going to transition now to Damaris. Come through. You do your thing.
Hello. Thank you, Lamont, for coming, and everyone else who's in attendance. My name is Damaris Redemar. I'm a community messenger for United Way, and I'm here to speak also on behalf of the dads, but also on behalf of the moms. I was 17 years old when I had my first child. I went through postpartum depression, didn't even have a clue I was going through that. I just thought I was tired and depressed. I had support from my family, but it wasn't in the home. I had my own home, my own family that I had to tend to. I had no clue what I was doing. I took care of my younger sisters, yes. Raised them basically, watched them, my mom work, but it's not the same when it's your child. It's hard. I didn't know what to do, what to say. I didn't know who to turn to. Like, I could turn to my mom and ask her, but my mom has her own life. She has her own kids she's still raising. I have 3 kids. It took me 13 years to have another child because it was so hard. I was so depressed. I didn't know what I was doing. I didn't have any support. I felt like, I felt like it was just me against the world. Like, I had my daughter's dad there. He was involved. But I felt like I didn't have anyone. And I felt like I was going to fail my child. I'm sorry. I feel like this program will definitely help a lot of families. I know a lot of people who have struggled with keeping their kids because they don't have the support financially, mentally, physically. They're there by themselves. They don't know what to do. They don't know who to turn to, just like I did it. On behalf of the dads, I can definitely speak, as I said, 17. My daughter's 16, going on 17. When he was there in the hospital, he was there from day one. My second daughter's dad as well. They basically put them in a cot in the corner, and it was mommy and daughter. I get that the mom and the daughter were just the ones that did all the physical things, but the dad also experiences emotional, physical, all of the emotions that a parent feels because they don't know what to do to help the mom and the child, especially because they're the providers. Most of the time, they have to go to work. The mom stays home with the child. The mom is home depressed, calling, texting the dad, like, I don't know what to do. They're at work depressed. This program will definitely help a lot of parents get through that postpartum depression, get through not knowing what to do, who to turn to. This program will definitely improve the being of kids in Bridgeport, Connecticut. I know there's other states in Connecticut, but Bridgeport, Connecticut has a lot of DCF cases. I know a lot of people who go through things like that. I know a lot of people who have tried to help get over it. I don't know what I'm doing. I thank God, knock on wood, haven't had to deal with DCF because I know what it is to have them involved. I didn't have them involved in my childhood, but I know other people who have, family members, friends. And emotionally, even though I didn't go through it, it was so traumatizing. I've been to a DCF office where someone's had to visit their child. I don't ever wish that, not even on my worst enemy. That is the worst feeling ever. You feel like a criminal. They check you, they make sure you don't run away with the baby. You can't bring a bag. The baby, you'll sneak a baby in the bag. I mean, I'm sure it's happened before, but it doesn't feel like you're a parent when you go there. It feels like you're a criminal. That program is supposed to help. It helps, but it doesn't help everyone. No offense. Because I know I've had a lot of people in my life that I've known gone through DCF cases because they're young. They don't know no better. They're addicted to drugs, alcohol. They don't know a way out. They don't know who to call, who to turn to. This program will change that. And I definitely love that about it. Now I would like to introduce Bev. Sorry about the cry.
Lavorne and Damaris, thank you so much for sharing your personal stories and making the exact point that Krista was making and the rest of us have been making, that we want to prevent the involvement of child welfare and universal home visiting, and community health workers are proven to do that. I know now is a point where I'm introducing any local or state officials who are here. Oh, I see Mayor Ganem. Mayor Ganem, you want to say a few words? Welcome. And I'll just look to Rob if there's anyone else to point out to me.
I want to acknowledge Councilman Newton, who's here representing the City Council as well. To the commissioners and the partners, Governor, and everyone who's here who understands. I think, Damaris, you brought it home as to why we're here this morning, and thank you for doing that. There's big picture, and then there's not the best one, but rubber hits the road, or the place where, you feel it in your heart. And that's what you reminded us of this morning. All the work that commissioners that you do under the governor's leadership have an impact everywhere, but you let us know it impacts. And United Way and to Bridgeport Prosper, thank you for your partnership and your leadership too. This is important stuff in the additional stress and challenges that the world is presented to us above and beyond in every way, shape, or form, accentuating or maybe making more visible the inequities, the vulnerabilities that we have as people, as a person, as families and children. I loved hearing that today. We looked at these challenges sometimes, how they impact people or individuals. That's great. But how they impact families and children is even a bigger challenge and a higher calling that's in part being addressed today. So I'm glad, and with universal home visits at a time when it's so critical, the parenting part. Somebody mentioned, and I think it was Damaris again, emotionally about the feelings of a parent. And I know there's a lot of parents here, and when this was said to me, it struck home. No parent ever wants to fail their child. Certainly not by their own actions or inactions, but by the inability to just do the things that you want to do as a parent. And there's no more scary time, and this is only from a father's perspective, of when that child is so vulnerable and newborn. And maybe you don't have the answers. And I can't even think about the complications and not understanding how to work through the challenges of maybe having a way to understand how to work through a healthcare system or mobility. In Bridgeport and in many communities in Connecticut, mobility is a challenge for parents. And so this addresses that as well. I know, Governor, in our organization in the city of Bridgeport, the best ideas and how to make an impact usually come from, we have department heads, you have commissioners. And it's because obviously they're there because they're leaders and we're leaders and before you appointed them, but because of their care and commitment of a specific area, and obviously that shows through today. But on top of that, and I know this from personal experience, your care and commitment about how to have an impact, and you're doing it, and the state of Connecticut is doing it in Bridgeport with this announcement today and all across. And just 2 weeks ago, I think, we were together with family and children they opened a Little League at Newfield Park. Councilman Newt was there, and it was challenged by public safety. And we stood together trying to, with words, never enough, but try to comfort those parents and those children about public safety in an area that had demonstrated that maybe it didn't really qualify for that at that moment. But we also said, and I tried to say it, and the governor's actually making it happen. You know, American Rescue Funds, federal money, resources, they don't do any good unless you have leadership that's willing to apply them appropriately in an area that will have an impact. And this is happening today, Governor, because of your leadership in the state of Connecticut and the partners on the ground. So from one who wants to admire and say thank you for your leadership, thank you for showing us how to get it done. Let's go out and do it. It's a great thing. Thanks.
Thank you so much, Mayor Ganem. It's really my pleasure to introduce our investor-in-chief, Governor Lamont, who charged us to work super hard to come up with ideas that would be transformational. He said, I don't want to look back in 5 years and say the money went out and helped for the moment. And I think today, Governor, you've heard from people on the ground about what a big long-term difference it can make. Thank you for being here.
Hey, good morning. And you're right, Beth. Federal government has given us extraordinary resources, and this is our opportunity to make a big difference in people's lives. And that's what each and every one of you are doing, and that's why we're here today. And saw you hiding back there, Mayor Ganem. I never saw you so shy and retiring. You know? And my other favorite Joe is Joe Carbone. Talk about a cradle to career. He's the person who makes that transition for folks who sometimes otherwise wouldn't get the opportunity. I'll tell you though, when the home visiting was brought up to me by Beth and Deirdre, it really rang home to me. And I'll tell you why. I mean, as we're getting through the ninth inning of this horrible year of COVID, I think one thing I probably overestimated and made a mistake on was when we said, all right, we're now going to make the vaccines available to people over the age of 75, and all they have to do is log on to VAMS. Well, some of us have a hard time logging on to Amazon. VAMS was really tough. And I was just reminded how important it is that sometimes you get a knock on the door from a friend. And we did that, GOTV, get out the vaccine. A lot of you are there knocking on the door, and what a difference that made. We created a program called LEAP because Thankfully, our schools have been open, but not everybody felt totally comfortable going back to the schools. And a lot of you, I think, were right there knocking on doors saying how important it is you can get back to school now. You can get back to school safely. And during that time when you realize your family's about to expand and you don't know what the heck you're doing, and Dad, you're right, we don't have a clue. I mean, talk about a trailing spouse. We're just learning along the way. That's when you really need a friend. That's when you really need a trusted advisor. And you don't necessarily get that always at a doctor's office or always, online. Beth and Deirdre, you get that by having a trusted person come knocking on your door. And you do that early. You do that prenatal just because you can prevent a lot of things. Ounce of prevention is worth a pound of cure, is what Beth told me as we walked in, a phrase that goes back hundreds of years. You have somebody come back again when the child is born, and you're just sitting there trying to figure out what can I do and how can I do it better. And then you come back maybe a couple months later, is that about right? And maybe an opportunity one more time for those other questions that may come along. And then we have community health workers going to the community more broadly. Look, if we found out one thing during COVID, you guys didn't find it out, but it was revealed yet again, is the incredible disparities in health outcomes based upon income, based upon race. Folks with those comorbidities much more likely to suffer the real tough consequences from COVID. Thank God for our nurses in red. Thank God for our nurses. You were there every day. You never hesitated. And now we're asking you to do one more thing, which is, all your free time, help us out knocking on the doors. But this is how we learn from what this last 12 months has been and how we do it better going forward. And I'll just say one last thing, that a lot of press today, this weekend, that was we used to have a baby boom, remember? And oh my gosh, we have too many babies. And now we saw the headlines around this last week that there's a real dearth of babies around the world. There's a real dearth of babies. Baby population's going down here in the United States of America. Older people outnumbering younger people, but not in Connecticut. Connecticut, we still have a little bit of a baby boom, for which I'm really thankful. I'm really thankful for the fact that people understand how much we treasure family. I'm really thankful for the fact that people understand this is a family-friendly state. Maybe it started with paid family and medical leave. Just give those moms and dads a little bit of a break very early on when that child is being born. What it means in terms of these home visits. Make that child, give him or her a little bit of a head start. Help mom and dad along the way. Beth, using our rescue monies, has the biggest expansion of daycare and childcare in the history of the state, making it affordable for everybody that can't afford it. And we're going to give that baby, we're going to give that kid, we're going to give that family the very best start in life we possibly can. And then Joe will get him a job 15, 20 years later. Anyway, I'm so proud of you. I love those stories. I take them to heart every day. And Mayor Ganem, you got to be proud. There's right here in Bridgeport, the baby bundle is really taking the lead. And I think we're going to take this around the rest of the state. Thanks, everybody.
Are there any questions? Yes. Mm-hmm. Yes. The model that we're talking about that we've researched is called Family Connects, which has 3 postpartum visits, but the community health workers would begin prenatal in making that connection. Thank you for that question. Any other questions yet?
Could I make a comment rather than a question?
Sure, what's your comment?
I'm Dr. Stephanie Pomino, president of the Connecticut Nurses Association, and we are delighted to be supporting you in this effort. But I don't know, I presume because of the work we do, that everybody is aware that America has a very low rating in maternal and child health, and a very high rate of maternal and child deaths. So I think the initiative you're doing here, which we support, so wholeheartedly is going to go a long way to improving that.
Thank you
My
for that.
heart is off.
And for those who might not have heard, the comment was that in the United States and in Connecticut, there are real challenges compared to the industrialized world in birth outcomes, child outcomes, and outcomes for new mothers, and that a program like this will really help. The other thing I want to say that you said earlier, there were some concerns because Family Connects is a nurse model. Would there be enough nurses? And you've assured me the nurses are on board, and there are nurses, and combined with community health workers who are trusted messengers, that really helps expand the reach. So I just wanted to make that comment.
You have several of our nursing board members here, and as I said, we put out a weekly newsletter to nurses. It reaches, what is it, 86,000 plus nurses in Connecticut, if they're all over it, and I will be writing an article to share.
Okay, so the nurses across Connecticut will hear about this after today. Again, thank you so much for being here. It seems like there are no other questions. Governor, thank you again for your leadership. We're excited to keep moving. There is a question? No? Okay, good to go. Okay, great. Thanks, everybody.